Hello. Wanted to share a series of videos outlining my signs and symptoms of having a hip labral tear, my diagnosis, the surgery experience, and now going through my recovery. When I was considering surgery, I spent a lot of time on YouTube and the internet scouring, looking for any kind of information that I could find on it. And there's not a lot out there, but the few videos that I was able to find really meant a lot to me and were inspiring. So I wanted to give back and just share my own story and hope that maybe anyone else who's considering it might be able to take some comfort or some takeaways from my experience. So this first video, I want to share what led up to my decision to get this surgery. So what I had was a hip labral tear on my left hip. Your labral is like a gasket ring that goes around your hip socket, and I had femoral acetibulum impingement. Sorry if I got that wrong. FAI, which means I had like a growth on the head of my femur that, as I rotated my leg in, was catching the labral and tearing it every time I moved my leg. So what kind of led up to this was December of 2019 is when I first started to notice the pain. Now, I'm not an athlete, I'm not a dancer, I'm not young, I'm 48 years old, and typically when you hear about labral tears, it tends to be more athletes that are getting it. So I definitely don't fall in that category. My day job is office work, but I do renovate real estate on the side. Have pretty much my entire adult life. So I have, flip houses. I have several rental houses with my husband, and our weekends typically consist of, really hard physical labor. So we do all of our own work on our properties. This particular house we were working on in December of 2019 is when this all began. I kind of think back on what I was doing at that house, and the hardest physical piece I remember was we were laying like a sheet vinyl floor in a room, and it was a big room, so it was a big piece of vinyl to handle. You have to have a really heavy roller that you push to roll it out and get the wrinkles out of the floor, and you got to, down on your hands and knees spreading glue with the trowel. And it's hard to say if that's exactly what did it or if it was just something else I was doing in the house, but there's no question that something happened when I was renovating that house. But it's also, too, I've read that it can come from just years of extensive labor. So it could have been something that I was tearing over a very long period of time, and that's just when it got really bad. But we were working on that house, and that was when I first noticed my hip. It's just like, man, my hip, I've got the worst pain right in the front of my groin. Didn't think much about it because in our line of work, there's lots of aches and pains every day, so you don't think a lot about it. But several months went by, kind of going into January, February, March. It was just getting worse, and it kind of evolved through a lot of different types of pain throughout the course of a year and a half. In the beginning, I would just be standing there and just get the most sharp pain out of nowhere. It was so sharp and stabbing, it would just make me yelp when it would hit me. And when it would happen, I would almost feel like the ball was coming out of the socket. Like I would kind of freeze for a minute and not move, and kind of give it a minute to settle back in before I would start to move again. So that was kind of how it all began. And as the months rolled on, that sharp sudden pain went away, and it just became more of just a constant, like, deep burning in my groin. And also, too, it started to kind of make a crunching noise when I would rotate my knee inward. And it was kind of sporadic. It wasn't something that I could reproduce purposely, but just sometimes when I would rotate it in, it would just kind of crunch and pop and grind. So as the months rolled on, I started to really struggle to like go on long walks, or even like clean my house for longer than 15 minutes. I would get very fatigued in my hips and have to sit down. So I decided to go on and go see an orthopedic. Went and visited in May, I think it was May of 2019, and they did some x-rays. He said, I don't really see arthritis. It's hard to say what it is. We would need to do an MRI, and you would need to go through a round of physical therapy before we would do that. So sent me home. I did not go to get the MRI. I'm kind of stubborn like that. I just thought, well, I'll just kind of wait and see what happens. So as the months continue to roll on, the crunching when I would rotate in just got worse and worse, to where it started random, and it was now completely reproducible. I could turn my leg in over and over and over and just crunch, 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 grind, grind. Got to where I couldn't walk more than about 10, 15 minutes. I would have to sit down. So this started to become a problem, because my husband and I really enjoy going on walks and doing things with our kids, and I couldn't keep up anymore. So kind of finished out 2019, went into 2020. When we would try to renovate houses, especially if I would try to go up and down a ladder, I would be out for like 2 weeks after. The pain would be so bad. And it was strange, because there sometimes was a week or two that I had hardly any pain at all, barely knew I had a hip. And then there were other times that I limped on the daily. And the limping just created a whole host of other problems, because when your gait is out and you're limping, you're stressing all your other joints. So I started to have back pain, and the inside of my left knee became a problem, and it was just hurting so bad all the time, and it was just getting worse. So I decided, going into 2020, kind of got through all of that, and I was like, you know what, I need to go back. So I went back to the doctor in July of 2020. So we're a year and a half into this now. Went back to the doctor, got the MRI done, and it was a very clear tear on the MRI, which was good, because he said, sometimes the MRIs are hard to read. Yours isn't hard to read. This is a extensive tear. I think he said it was like 1.2 centimeters. There was another little 2 millimeter area that could have been a tear too. He wasn't sure. And they could see that the head of my femur had that growth on it that was impinging, which was probably the crunching sound I was hearing. Was when I would rotate my leg in, that growth would catch the labral and pull it and kind of get it inside the socket, and which was creating the grinding noise. So he said, you have to get surgery. The goal, I think, was to prolong the health of my hip, and prolong having to get a full hip replacement, because that labral, it's like a gasket that keeps the fluid inside your socket and also helps absorb the shock when you're walking. And so when it's torn, you have no stability in your joint. All of your other muscles are in hyper mode trying to make up for that difference, and you've lost the fluid, which is helping prevent the bone on bone that can create the arthritis over time. So he was like, you just, if you don't get this, you're going to be getting a hip replacement very soon. So I went ahead and made the decision to get it. It's a very scary decision, because this is from what I understand, hip labral causing pain is a fairly new discovery. So I think it went unidentified until maybe the last 5 or 10 years. I'm not really sure. And the arthroscopic surgery to repair it is, fairly new too. So there's not a lot of long-term studies on the success rate of the surgery over like 2 to 5 year period. I think there's not a lot of just data for them to go off of. And given my age, he said, people under 40 have a better chance when we repair the labral, that because it's cartilage, it doesn't have a lot of blood vessels going to it, which are something really critical to making things kind of heal back together like a cut. And when you're under 40, the odds of that kind of reattaching are better than when you're over 40. But with that, he still felt like, it would be successful for me, we hope. So they did the surgery. I had 4 anchors that were put in, and they reshaped the head of my femur. So I'll do another video that will just kind of walk through what the surgery was like, that whole experience, and then follow that up with some videos of my physical therapy and just how it's going. I'm on day 10 now, so I haven't been to physical therapy yet. I actually start next Wednesday. Super excited to just move my leg around and see what it's going to feel like. You know, it's so early in the game that I just have no idea, but one thing I do know is a lot of the pains that I had before the surgery, I don't feel right now, and that's very promising to me. I mean, I have a lot of new pains from the surgery, but just certain types of pains, like especially sleeping, I could not sleep at night prior to the surgery. That was one of the biggest things that led me back to the doctor is I don't know why, but every night I would get up about 2 o'clock in the morning and the pain would be so intense. I could not find a position to help. The best position I found was laying completely flat on my stomach, seemed to help the most. But even with that, it kept me up all night. I sleep better now. Even with the pain of the surgery, I sleep better now than I did before the surgery. So I see some promising signs, but I do know it's very early. So if you are thinking about going through this or you've been through this and you want to kind of follow through this series, just be sure to subscribe, and I will be posting another one probably in the next couple of days. And please put some comments, share your stories, and or if any questions you have, be sure to ask. I'm happy to answer them the best I can. And I appreciate everyone who put their videos out there, and hopefully this will help some others as well. Thanks.